next to me is Irfan Malik. I don't know how the hell I got in touch with you, but somehow we did from some AI story. But what he's doing, again, seriously, it used to be like Silicon Valley is owned by Americans, I'm one of them, or that industry. But with AI, that story is over. Anybody sitting in Burma, Sri Lanka, Pakistan, Lahore, Sheikhupura can shock the world. Irfan is one of them. Irfan, you want to tell us a little bit of your story?
Thank you very much, everyone. I started as a computer operator from a medical college, and now I own a company, Zeven Solutions. We are providing healthcare solution primarily using artificial intelligence. I'm a data scientist by profession. We have got companies in different countries. I would say that we are recreating few solutions, like talking about EMRs, HIMS, telemedicine, talking about patient-doctor interaction. We are recreating it because artificial intelligence is redefining every single thing. And we are taking it, from the scratch and implementing it everywhere. We are not kind of, I wouldn't say that we are innovating something, but what I usually say that artificial intelligence is making successful startup incompatible. What is coming in the future, we are, getting incompatible with all the data, all the success, all the investment that we have spent so far in our systems. So this is a right time to, redefine your system so that whatever is coming in the next 6 months, I would say next 6 months, not year, not 2 year, not 3 year, whatever we are coming in the next 6 months, we have to be ready. This is exactly what we have identified, and we are providing solutions in various departments. That's a brief introduction, and I think we have the entire story covered there in the second.
It's coming, and if you go to YouTube, let's say if you want to write your own or AI or little chat box, and how do you do that? You pay other thousands of dollars, or you learn yourself. But how do you learn yourself? You don't know computers. You listen to his YouTube, you know how to write your own chat box. You make your own AI little tool to use for you.
This is mandatory for everyone sitting here because you have got lots of knowledge. Major problem in the healthcare sector is we are wasting a lot of data. And now let's not talk about patient data. Let's talk about your wisdom, your knowledge that you have got. Whatever you're explaining to your students, patient, friends, family, it is going nowhere actually. Now, this is a time when we have to preserve every single thing, and the LLMs are out there. There should be a GPT for all of you. And there should be a tiny little device that you carry with you, whatever you are saying, whenever you are saying something. Apple is listening, Facebook is listening, Google is listening, whatever we are doing, somebody is listening. So if they're listening, they're getting the data. Why can't we use that data to our advantage?
Yeah. All right. So I think we can start with some questions. Yes, go ahead, Tamizuddin. Yes.
Assalamu alaikum. I'm Professor Asad Nizami. I'm a professor of psychiatry here at RMU. I'm very glad that Dr. Baba Rao and Dr. Shah Rafiq organized this session. Why I say this? Because it's very intriguing to look into what people are talking about, but then we must identify where the problem lies. So if you scan around this whole room, you have a number of health professionals, and I'm thinking very esteemed CEOs of different very innovative organizations, very few policymakers. Our problem comes with a very, very big misconnectivity. And why I say is this because I've been working with the WHO, even the regional office and the Geneva office for the last 25 years. When we talk about all these issues, I know this is a requirement of the time that we have to be innovative. But then majority of the times our health professionals are only thinking about providing health service, medical education, a little bit of research. The innovators on the other side have very fancy and very good ideas, but then there's a very big disconnectivity, this side translating the ideas to the other side. And there where the problem lies. For example, one of our colleagues just talked about that if Google is listening to everything, why can't we have a device that we can translate what we're thinking? So I'm just wondering that I know we have got a big MOU signed and we are going to sustain that, but we need to look into this aspect that all medical students, all health professionals, when they come into providing a health service, they're thinking only one thing. This is what we have to do in morning. This is what we do in the evening, provide a service. They're not innovative. They're not creative. They need to get that time to think about the creativity. And on the other side, we need to have this bridge linked up, that how can this innovation be transferred to the health professionals so that they're actually using the word compelled to use this innovation into their basics.
So I'm going to go to Irfan a little bit. So Irfan, obviously, I think he was working as in the hospital as average job we all of were doing at some point, and then he came up with the ideas. And can you just briefly tell particularly what you are doing now, where your company is in the process of getting some Facebook like $1 trillion?
To explain what we are doing, I need to address a very important point here. There is a huge gap. Dr. Sorry, I couldn't catch your name. Professor Asad Nizami, sir, you have raised very, very important points. I would like to address that, then I'll connect that with our growth. So what is happening? I mean, if I may ask, how many data scientists are sitting in this hall? Maybe 2 or 3? Because I know one of the gentlemen here. Yeah. 3, right? And the rest of them are, I think, healthcare professionals. So what is happening? We are talking about innovation. We are talking about creativity, creations. We are talking about ease. We are talking about many other things. So let me be very clear as a data scientist. We cannot do anything, literally anything, without the healthcare professional. I'm not talking about collaboration. Going back a few years, when you were going to develop a certain software for the healthcare industry, it was like giving them the problem and the specification and everything, and the tech team was able to do the job pretty much 100%. But now the game is different. Collaboration is a small word now. We have to sit together. We have to spend time together. We have to share our brains and thoughts with the data scientists, and then they'll come up with the effective models. There are so many things happening in the healthcare sectors. We have so many ideas, but I am 100% sure not a single idea is 100% validated or authenticated if there is no healthcare professional involved. Not just involved, but the part of that idea. So the collaboration is not enough anymore. We have to sit together. In my company, we have doctors, Professor Dr. Javed Iqbal. We have many other doctors who are working full-time with us. What we are doing, we are sitting with them like 6-7 hours a day sometime, and we are understanding this is what we are going to do, and let us know how we are compatible with what we are trying to achieve. And then we are reading their brain. So I was facing a challenge. I created a software, a simple AI-driven EMR, a basic simple AI-driven EMR, and I tried to implement it in a hospital in Rawalpindi, which is not an advanced city, and I couldn't do it. 6 months of effort, I couldn't do it. Challenge: adaptability. Staff, doctors, nobody was able to cooperate and understand that. I had to buy the hospital. Then I had to recruit my own staff. If I'm in power, at least I'll be able to enforce it. And then I'll be able to set an example for the world that what AI can do for you. Crossing that barrier was very, very difficult for me. And I had to spend a lot of money on the hospital to do that part. So this is where the problem is. And this is what we are trying to solve our first goal is, as a social media influencer, I don't call myself influencer, but what I'm trying to do, I've spent many years in healthcare sectors and in tech. So I know both worlds. I'm trying to educate the healthcare sector. No, I don't have to educate you, but in terms of AI, so that we could get more validated, powerful ideas out of your brain, and then it is a walk in the park for us to implement it. Actually, I have got 200 AI experts in my company, but they cannot think like this. They cannot innovate in healthcare sectors. So that's why I'm here. That's why I'm talking to healthcare professionals and going here. And this is the first thing that Zavin Solution as a company is doing to reduce that intellectual gap, not a communication gap. I won't call it a communication gap. It's an intellectual gap. To reduce that part, bring both the forums on, both the worlds together, and not in terms of a collaboration, but we have to sit together like a skin in the game thing. I'm making arrangements by different hospitals so that you invest, I invest in the system, and we create it together. Okay. And if you have the skin in the game, then we will innovate actually a good system. This is our goal, and this is what we're trying to do.
So I'm going to ask you a simple question again. Is the company making some money so that Pakistan is making some money?
Yeah. Oh, money is a byproduct, honestly speaking, and the company is making a lot of money. And we have system. We have deployed system in different countries. There are, many countries. I mean, we have got system in US, we have got system in Nigeria, Australia, South Africa, and now we are entering in UAE. So our system are being used, but honestly speaking, I'm recreating those systems as well. Why I'm recreating those systems is very important for everyone to understand, is that, AI is about data, everyone know that. And AI is about structured data, not only data. We know that AI is about data. AI is about structured data. So the question is, we have so many systems, Dr. Kronos, Cerner's, APPNA, there are so many systems in so many different organizations. They were created like decades ago, 2 decades ago, 3 decades ago. Their data, the structure of their data is not compatible with the latest LLMs that we have today. And if we just try to refine that data, mine that data, we may lose 50, 60% of that precious data. So what we have to do today is to create system, reinvent system that are AI compatible. So if new LLMs are coming, new neural networks are coming, new image recognition techniques are coming, our data should be in a perfect state to get the best out of AI. We are doing that part. Our previous system are doing well, and at the same time, I'm restructuring.
Yeah, I think that is really important. Okay. Anybody in the audience has a burning question for any of us? Yes, please. Please introduce yourself.
Thank you. My name is Dr. Shamail. I've been affiliated with various ORICs and been playing my role. My question to Irfan is that what I felt was, during my observation, was that a lot of the research, when we look at it from the other side, sometimes lacks the credibility or the validity or all those aspects which make it the money side of it. So I think that as it was mentioned earlier, that the collaboration between the innovators is lacking, because sometimes the clinicians are not looking at it from more than their clinical side. And obviously the success has a lot of softer sides. So my question to the data scientist is that with the help of this AI, that thinking process, which is supposed to be done by different stakeholders, how do you see, how can we really accentuate the AI engines to do that innovative part, bring out the exploitable business aspects, and fast track, as you mentioned, that things are going to happen in months, instead of waiting for somebody to really look at the whole menu and find out the exploitable business prospects, which will convert into the success that we are looking for?
Great question. So again, this is the second thing that we are doing as an organization. So I'll connect it with the one point that is coming up for like a couple of times now, making money for the country. See, if we really want to do something for the country, make a lot of money for the country, it doesn't matter how many AI engineers we have got. It doesn't matter the scale at which we are providing the tech services. I don't think so it matters, because it is not permanent. It is not sustainable. We have to create our intellectual properties. What is our intellectual assets? How many systems that we have produced from the Pakistan that we say proudly that this is a Pakistani system being used in US and everywhere? We talk about Dr. Chrono, we talk about APPNA, Cerner, many that there are other systems. We, Pakistani, are using their system and we are paying them. Sustainable business model. And now if this is the sustainable thing for the country, creating your own intellectual assets, then comes your part, that how we really can do that. How we can make it faster by using AI. See, we need to start intellectual collaboration, and we need to stop wasting our data, our wisdom. So let's say if Dr. Shamail, if you're not working with any tech company, any software engineer, so that means your thoughts, your wisdom, your experience is confined. We are unable to use it at all. Now the question is how we can use it. 2 ways that we have to do it today. Stop outsourcing your needs to the tech companies for the sake of services, and start collaboration by bringing their skin in the game on a stakeholder basis. Collaborate with the smaller startups. You'll find so many startups in Pakistan. You can empower them not by your money, but by your wisdom, your experience. They will come up with the solution. Now, how you can empower us? As I said, that everyone here should have their own GPT. There should be a shmailgpt.com. There is no hurdle in it. It can be done in one day. Have you ever considered it? One day, not more than this. One day, a tiny amount that will be paying on a monthly basis. And now LangChain is actually making it possible. I'm not even talking about OpenAI. I'm not talking about ChatGPT. I'm not talking about Facebook's large language model. I'm talking about a different technology, which is almost an open source. So you're sitting at home, you are imagining something, open a recorder or any transcript application and start talking. The transcript application will convert your thoughts into text and give it to your model. Create a website, upload your data. And then in few days, weeks, months, you will have your intellectual clone and you can send it to any person like me. And I'll ask question to Dr. Shumail without even taking your time.
VC Saab have a comment. Yes.
Thank you very much. So I'm just the humble learner, so I not have the appropriate, question, but question frame up. But I think this is very pertinent to the university that how it trickled down to the students and they come up with these ideas. I think we have made the artificial intelligence part of curriculum. So we start from very early niche because they must be first introduced to they become mandatory for 5 years in different step in a spiral form, how to learn about the artificial intelligence and practice artificial intelligence and build up a data. I was still struggling for 1 year to find a single person who can help us out, that how we can, put that strategy into practice of teaching to the students. So this is a very simple but very important concern on my side as a vice chancellor.
So I think
I have
Irfan may have
something
a
very
choice for
important
you.
here actually.
Mhm.
You brought up a thing that will solve many problems in future. This is a root cause. So what I've been trying to do as an organization, I've created a syllabus for MBBS professionals. Don't teach them AI. First, teach them the basics of technology. The thing that I've put together, I can share right after this meeting with you. It's a little booklet. What they should study. What is www? What is server? What is mobile? What is API? What is front end? What is back end? How data can go from one device to another device. You don't need any technical background at all to build that block, because I have studied both the worlds and I sit together with a good doctor like Professor Javed Iqbal sir and many other doctors to put together everything. And we are trying to use all of our connection to make it a part of syllabus everywhere, that they should read it. You know what? If they'll read it there, they'll come up with the critical thinking in the world of AI. And then comes innovation.
So I think I have a solution for both of you.
This thing is ready.
I'm gonna ask Irfan to become an honorary lecturer advisor to this university, and the problem will be solved.